Welcome back, everyone, to the podcast number 39 or 40. I don't remember now. But on the other hand, my main focus is always to give you the information. So, information which is always helpful to the Gen Zs, to the newbies, and the people who are still into their career, building their career. And most important thing, we get the knowledge or information from those people who already have achieved what we want to achieve. Yet, they are also getting on, they are also working on their own career paths, but they at some point of time they are people where we see. Today I have Dr. Mandeep Singh from Dubai, and he is a trained specialist in material fetal medicine and fetal surgery, and his experience over 20 years. And this can be a very good opportunity for those who wanted to start their career or they are into this career, and they can get to know how the career looks like. What are the things he is doing right now? What are the new research he is working on? And how does the his research is helping the people in the daily life? So let's welcome Dr. Mandeep Singh. Welcome, Dr. Mandeep. How are you?
Thank you. Thank you, Kuwar. I'm very well. I'm glad to be here.
Same, sir. Glad that you have given us some time, and I will try to extract a lot of knowledge from your side for the viewers who wanted to build their career in the medicine, in the gynecology, and these section. I hope that it really helped them in the near future.
That's absolutely fine. And if anybody wants to get in touch with me directly, that's absolutely fine as well.
That's great. So, if we start, Dr. Mandi, if we start with your career, like from where did you start and how did you think, why do you want to get into the obstetric and gynecology? It's a very least preferred by the, I would say, the stereotype thing, men's.
Yeah. Yeah. No, thank you. And I'll take you back. My journey actually starts from my school days. And that's where I think a lot of people struggle to make the right choices and sort of seek guidance as to what is the right path for them. I guess my father was on a transferable job. We used to change schools every 2 years, and I was a very bad student. I struggled almost in every class. I think I remember the first time I passed all my subjects was in year 10. But then, as they say, that it's never too late. I think something happened in year 10 in my half yearly exams. I suddenly got the confidence that I probably can do better. And I passed my 10th standard exams in first class. I think in Maharashtra, that's where I
Wow.
did my 10th standard. Everybody used to get 90-95%, and I managed to get 72%, which was a big credit to me because I was a very terrible student. Anyway, that gave me the confidence to choose science. I never wanted to do, and I never imagined myself being a doctor. I thought I would probably join the army or the police like my dad and sort of carry on the family tradition, as they say. But not that they are not good in studies, but I was always inspired by them because that was my home environment.
Mhm.
In my 11th standard, I moved to a college, which was a much different atmosphere. And while doing my 11th standard, I was talking to people who wanted to be doctors, and in that group they were all high achievers, and I was probably one of the ones who had never achieved anything big. So heard them talking, and I thought, oh my god, if they can do it, what is that is preventing me from doing it? But then,
True.
you carry that legacy that, oh, you're not a good student, how can you aim for a medical school? And I think I decided that day that no, I'll try and give it my best. I spoke to my parents, and my dad was very supportive, and I said, okay, fine. Nobody knows this that I'm trying for medicine, so why not do it? And
Mhm.
in my 12th standard, I managed to get good grades, and I think that's the start of my journey. So this is a message to all those who don't do well in school. There's nothing that you can not achieve. It's all your commitment or your passion that will drive you to achieve whatever you can. So don't underestimate your own strength. and trust yourself is the main message that I want to give with regards to my first half of my journey.
That's an incredible thing because even I am one of those who is a backbencher. I'm not a backbencher. I'm a middle bencher. ना ही टॉप पे कभी गए ना पीछे कभी रहे. I was a middle one always. But yet, uh, my father always used to say कि I know he can do something in for his own, but doesn't know whether you go in a profession. Just like my father was also in CSF and my grandfather was in defense. So I didn't opt that. I said I will do something different, but I don't know yet over here.
Brilliant.
Okay. So, doctor, if I talk about your, as I was researching about you, you're the first doctor, first Indian origin doctor to perform uterospenia bifid repair surgery. I guess
Yeah.
I know I can take those names. They're the big names for a common man like me. So, and you led a team in the Burj Medical City, right? Can we know about something that?
Yeah. So let me just take you back to my background.
Mm.
I basically did my MBBS in India, in Solapur. It's in Maharashtra. And I once I finished my MBBS, in our days, there was no NEET exam, so we would get post
Oh,
graduation in the subject that you scored the highest. I never wanted to do obs and gynae. That was never my intention. As you said, stereotypes, men,
yeah.
pagdi. There's not a typical gynecologist, so I always wanted to do medicine or surgery. But I don't know how I got the highest marks in obs and gynae. And
Okay.
and in my days, obs and gynae was to be a very hot branch, especially in Maharashtra. It was the
Hmm.
top third branch after orthopedics and pediatrics. So unknowingly, I opted for obs and gynae, and that's where I absolutely had no idea what I was doing. But as you say, I just went with the flow and chose obstetrics and gynecology. Um, and that's where my journey started. I then finished my MD in obs and gynae. Obviously, I always wanted to be the best. So I wanted more surgical experience. So I picked up a hospital in a tribal area in Maharashtra, in Dhulia, if you know the geography of
Yeah.
that orbit. It's a tribal area. So I thought that will be
Mm.
where I my maximum experience. And I worked there for a year. Very, very loving place for all the Sikh students. I think Dhulia is on the transit way to Nanded. A lot of people traveling from Punjab to
Oh,
Nanded, they stay overnight at Dhulia. There's a big gurdwara. A small community, but a very, very loving place. So that's where I worked for 1 year. And I think that was the game changer for my entire obstetrics and gynecology career because I learned the basics there. Um, I picked up all my surgical skills. So never hesitate from picking up an area that is good for your career, even if it means going to a tribal area, because that
mhm.
was good for me as a doctor. So that was the end of my training career. And then, as everybody wants to, then by that time I was 27, 28, and I wanted to come out and become a big doctor in Mumbai. That's where my father was posted at that time. So I went back. And that's where, till that time, I was very confident because I was the best. I was the best in my medical school. I was the best in my post graduation. And then when you
Okay.
come out in the real world, then you get a big shock. Kuwar, tell me when you want me to stop because I could just carry on.
Okay, I will. So I have a just small question over here. Because students always try about the first posting, they always try to be very calm and easy. Then you have choose a tribal area. I guess that would be a maybe I don't know about your parents. Maybe they are not in support, or they were in support of the you're choosing of the Dulera, the tribal area.
I think I always want, and my parents always said that you should do whatever you want to do, but
Mhm.
be the best. And I think if you want to be the best, then the problem is not the problem, but the challenge is sacrifice. We
Yeah.
have to make sacrifices in the beginning of our career to have long term stability and growth. If
Mhm.
we don't make, I know the Gen Z doesn't agree, with me. My own son is 26 and he doesn't agree with me. But that's how my generation was. But I think that holds true even today, that you nothing comes easy in life. We have to work hard and we have to sacrifice. And I think if you enjoy your profession, I think the place doesn't matter.
Okay. So if I like you started telling us about when you come back to Mumbai, I guess I'm very interested or very keen to know that how was your journey from Mumbai to Dubai? And I guess now you're
Yeah.
traveling all the world because of the fatal all the events. But yeah, the journey from Mumbai to Dubai, I really want to know because
It's a
that's a thing people really want. Doctors, new doctors, they want their career to be grown like this. Over to
So
you,
it's
doctor.
sort of a longish journey. It wasn't India to Dubai. I went to the UK. I've been in the UK for the last 22 years. And then Dubai only happened 3 years ago.
Okay.
So when I came to Mumbai, I got a big shock because I was in the real world. And the real world can be extremely cruel, and especially to the newcomers, because
True.
there is no mercy, or there's no leverage there for you to sort of do what others do. So I started working, and that's where I got my big shocks. Obviously, every type of hurdle, whether it is not having a place that I owned, because in those days people used to make nursing homes and run their practices. My obviously I didn't have the money or the means to build up a hospital. Big hospitals would not give me attachments because I was a newcomer. Then the same thing. Oh, you are Sadaji, a young guy, women will not come to you. Why will they come to you? And all of that. But I knew in my heart that this is what I want to do, and I'm good at my subject. So the rest will come. I
Mm.
was very, very, very disappointed at one stage, and I didn't know what to do. Literally, I was on the verge of a breakdown because it was almost 3 years that I'd been struggling to build up my practice, and nothing was working. I The system obviously is not straightforward system. There are things that you have to do as a newcomer that are may not be ethical. And one thing I was sure in
True.
my life, that I will not do anything that is not ethical. And I think that's where the other challenge was, because the easy path is just to pick up things that are easy, but against what you believe in, versus a difficult path that is the right path, and you don't compromise your ethics. And I somehow chose the difficult path. um, my father always said that, see, you cannot on your own change the system. Either you be part of the system, or you go into a system that suits your values. And I think that's where I decided that I will go to the UK and do training, and probably come back at some stage, so that I'm more of a senior person rather than a junior person.
True.
That's when I did my exams, and my journey. My first step to the UK was in 2003 February. That's when I landed in the UK. I don't have anybody that I knew in the UK, or didn't have any sort of backing in the UK. But that's the start of my journey in the UK, Kuwar.
That's a great one. And I guess, and there was no look back after that, I guess. So you have already struggled a lot for that, if I'm
Yeah,
not
but
wrong.
yeah, but then that was the beginning of my
Hmm.
career. As you all are aware, UK does not recognize any of our Indian degrees. The
Yep.
only degree
You
that
have to
they
do it
recognize,
again.
yeah, the only degree that they recognized was my MBBS, which was okay, but my specialization wasn't.
So you have
So
done it again over there.
yes, so I trained again in the UK.
And
So I
how did it started over there?
so I did my PLAB exam, which basically is an equivalent to MBBS. So that gives you a license to practice in the UK.
Hmm.
I joined a small hospital there, and within like 15 days, they immediately recognized that I am much senior than an MBBS doctor. So they said, you don't have to start as a very junior person. You start as a registrar, because we can see that you can do most of the procedures. You understand obstetrics and gynecology much better. So that was the first break that I got into the system.
Oh, nice. And it's a very difficult because if you are highly qualified and still you have opted to start with a small hospital, and it's very great that they have recognized your talent and then they have coming up with you,
Yeah.
right?
So in the NHS, you have either district general hospitals or tertiary hospitals. Being a
Mm,
newcomer, I've been to a district general hospital. There are like 125 district general hospitals in the UK. So I joined one of them.
that's great.
So
So,
then I can continue,
yeah,
Kuwar.
yeah, yeah. You,
So
you can continue.
so the next step was, how do I now break into the system? Because just getting a job is not good enough. I need to be able to get into the training system, because in the UK you could either be a service doctor, that means you will always be a junior or a middle grade doctor for the rest of your life without any progression, or you could get into the training and become a consultant. And as everybody else who goes from overseas, I wanted to do the training and get become a consultant. But becoming a consultant was again extremely difficult. There were, for every 100 applicants, only one would be able to get into the training system. And to be able to get into the training system, you would either need to do an MD or a PhD in the UK in research, and then apply for the training number. So I, by that time, was very disappointed, and I had lost all hopes because I had struggled in India, and then I
Mm,
went to the UK, and my struggle had never ended. And I thought, you know what? I'm tired of all of this. I have absolutely no uh, interest in continuing obs and gynae. At that time, the UK was short of general practitioners. So I said,
okay.
absolutely, I will become a general practitioner. Nothing wrong in general practice, but I thought, because that's an easier way, let me do it. So I went and said to the coordinating team there that I want to do obs and gynae. I want to do general practice.
Good enough, yeah.
One of the panel members in that panel was an obs and gynae consultant, and he had seen me work. So he did not say anything at that time, and he said, "Yes, son, if that's what you want to do, we will try and help you." And I finished the meeting, and I was going home. And then while I was walking on the road, suddenly a car came from behind, and the window rolled down. And this was this guy who was sitting in the panel. He looked at me and he said, "Why do you want to do general practice? Just because you cannot get what you want in obs and gynae?" I said, "Yeah." He said, "But I know you're good. You listen to me, follow my advice, and you will be one of the best doctors in the country. So, but come and meet me tomorrow." So I went next day, and he said, "I'll get you research, and but it's a long journey. It's a hard journey. You will many times in your life regret walking this path. But remember that once you finish this, you will be the best." So that man changed my life.
Oh,
Yeah,
I
He
guess
was
that
from
seems to be a movie kind of a thing that somebody is coming
yeah,
from nowhere and holding your hands.
yeah. He was from Ghana. He I had not known him at all. He just came as a savior and guided me in the right direction. And he knew Professor Nicolaides. I guess people who have worked in fetal medicine, Professor Kypros Nicolaides is a pioneer in fetal medicine. He's like called the father of fetal medicine. Very
Yeah.
hard researcher and a very celebrated fetal medicine person. So this consultant took me to Kypros Nicolaides, and that was the second beginning of my second life.
Second innings of the life.
Yes, absolutely.
My
Yeah,
my question was coming up on the same that you have trained under him, like the father of the fetal medicine. And how was your experience? And how did you think that the doctor is changing the path? How the research is under him?
yeah. So uh, Professor Nicolaides is known for his research. So when I met him, he asked me. He was doing a research study at that time, a very large study. He planned to recruit around 35,000 women into that study,
Okay.
and he needed fellows for that. So he said, "Mandeep, do you want to do this?" I said, "Yes, absolutely, I'll do this."
Hmm.
But then I joined him without thinking twice as to what will happen. The salary was very low, because in research you don't get paid as much as you would get paid when you're working in the NHS. You get paid
True.
based on the grant. So I was getting like 1,500 pounds at that time, a big drop from my previous salary. But I thought, okay, I will do this. So 3 years were extremely tough. Professor Nicolaides has an extremely, he's a workaholic. He works till 3 o'clock in the morning, and you all are expected to work and then come back at 9 o'clock in the morning to start the clinic again. It's extremely disorganized. And in research, there is no doing what others do. You have to create your own path. And that was very
Mhm.
difficult for me, especially going from India. Somehow our system, education system, more of at that time, was a very stereotype system. So everybody walks on the same
Correct.
line. Nobody switches path. You just, in research, there is no path. Nobody has
No,
done
no,
what you have
no.
done, and you will not do what others have done.
I guess you will make the path in the research.
Correct. And that path is, then you have to ask yourself, what is it that I want? What is my journey in this? And I think that is extremely, extremely difficult because we are not brought up in that way. We are always brought up in a way to look at others and follow others. Um,
True.
but I think that was a big challenge for me. I finished my research in 2007. By had that time I had learned fetal medicine. I had learned research, and I got my training number, which I wanted to get. Um, Here, I want to again take everybody listening back. My CV was extremely good. So when I applied we were allowed to apply for four places. I applied for four places, and I got shortlisted for all the four places.
Wow.
But at that time in the UK, the local doctors were not getting shortlisted. So they went to the government, and as with any political party, whether it's in India or in the UK, the UK government decided that every student who applies for a number will get at least one shortlisting.
Okay.
So
Nice.
everybody local, or you can call them as the ones from the UK, the Goras, would get shortlisted for at least one place, and we overseas can get as shortlisted to at least four places. But when the local went for an interview, they were picked up immediately because they were locals,
Yeah.
and we were not picked up. I did not get picked up even after doing four interviews, and then there were people who had no research in their CV because the system
Still.
had changed by that time, and they did not care about research or papers at that time. But I was in the waiting list, and somehow I got a number, and I got a number in Cambridge. So my the training was in Cambridge, which was good because Cambridge is one of the best places to
Top.
train.
Yeah.
That's
It's
where
one
I
of the
did my
top colleges. Yeah.
yeah. That's where I did my training in obstetrics and gynecology. And then because I had trained in fetal medicine, I did further subspecialization in maternal fetal medicine. So subspecialization is where if there are 100 obs and gynae consultants, one of them can subspecialize in either fetal medicine or urogynae or gynae cancers. So because of my background, I chose fetal medicine,
Fetal
and I
medicine. Yeah.
3 years of training in fetal medicine, maternal fetal medicine.
Fetal medicine. Okay. So if I talk about the fetal medicine, right? So there are only 14 centers in the world. Sorry, I've missed that question. Fetal medicine.
So there are
Okay.
14 centers in the UK that do fetal medicine,
Yeah.
maternal fetal medicine. For those
There are
who
only
don't know
14
what
centers.
fetal
Hmm.
medicine is, basically we look after women with complex medical disorders. So that means if somebody has a heart problem in pregnancy, or has epilepsy in pregnancy, or a cancer in pregnancy, or rheumatoid arthritis, or an autoimmune disease, a medical disorder in pregnancy, then we take them through the pregnancy along with the physicians. So that's the
True.
maternal medicine part. Also,
Mm-hmm.
we are specialized in imaging. So we diagnose if there is any abnormality in the baby, unborn baby, and then we try and manage that abnormality inside the womb, and then deliver the baby in the best circumstances so that the baby can then be looked after well. So that's fetal medicine. So diagnosing problems inside the womb and managing pregnancies is my specialty. So basically, I am an obstetrician by background, and I specialize in women with complex medical disorders or babies that have malformations or abnormalities.
So, if I talk about the medicine plus AI, you just spoke on the Forbes Middle East that AI driven pregnancy care, right? Where AI is actually changing the clinical decisions today, right? But uh, don't you think it's just a hype? The AI word has been attached to everything, or it actually helping up?
I think AI is the future. AI is basically going to replace anything that is repetitive and non scientific. Like, just to give an example, when we do normal ultrasound scans, it's all about pattern recognition. And that is very much what AI can do. That helps us focus on areas that are abnormal. So I think AI also, the most important thing, and one of the things that in medicine is not talked about, is human factors. If I am doing a task at 10 o'clock in the morning versus doing
Mm-hmm.
the same task at 3 a.m. in the morning, there is a big difference, because at 3 a.m. my senses, my awareness is not as better as at 10 o'clock in the morning. And unfortunately, diseases and complications don't happen between 10 and 5. They happen at any time of the day or night. And I think AI will always give you the consistent feedback. It will also not be affected
Mm-hmm.
by time of the day or night. I think that's where AI has a big advantage over doctors. Uh, Not over doctors, but it is always a supplement to doctors. AI will never
Supplement
replace.
doctors. Yeah.
It will
I
always
always
be.
believe this. I
Yeah.
always believe that AI is the one of supplement to us, not he cannot replace us because there are a lot of things where we need to humanize it. Rather than as I am from healthcare, I market the healthcare. So people do ask this question that robotics is there, robots are doing the operation, but they have been trained, but it cannot be fully trained or cannot be known as a doctor in the
Yeah.
future. But doctor, I want to know one thing. Is there a risk that AI is matlab high risk to obstacle and could create a false sense of certainty for doctors or a patient?
I think I'll take this question in two parts. For doctors, I think it is, as we said, it's a supplement. So you all have to challenge AI. You cannot just sort of take their opinion and say, okay, this is what I'm going to do. No, no. It will only help
Mhm,
you think in a different way. But ultimately, you need to choose what is best, because in medicine, it is not always about what is the natural course. It is about what does the patient want, what is right
mhm.
for the patient, what is right for their entire family. So I think that's best done by doctors along with AI. For the patients, I
Yeah.
think it is important that the patients have a good understanding of the disease or the suspected disease that they are consulting the doctors from. There is no harm in taking opinions. As we do, we would go to two, three different doctors and then seek the best different opinions. So I think AI has the capability of giving different opinions, but as before, I think that helps the patients understand. And when they are in the
Mhm.
consultation with the doctor, they can always challenge the doctors on different diagnoses, different tests. And I'm sure your doctors will always be very helpful, because for me, an informed patient in my clinic is the best patient. It's very difficult to kill somebody who does not have any understanding, and then sort of our task is double, to make them understand and then help them to make their own choices. If you understand the
Mhm.
disease, much easier for you to make choices, because choices are not about me as a doctor. Choices are about you, as to what do you want for yourself, rather than what I want for you to do.
But don't you think people, obviously they are a common man and they don't know the whole things and they are somehow they read it about the fetal medicine or the issues they have, but they don't have the full knowledge. But isn't making you task difficult for you to convince them that what they have read may be wrong and it may be based on some other research?
No, I think patients are very intelligent. I think it doesn't matter whether they have gone to school or college.
Hmm.
Everybody has that basic intelligence. And then again, it comes to your skills as a doctor. If you
True.
can communicate well with your patients, they will understand very well. If you cannot, then obviously it's a struggle.
Yeah. Okay. Definitely. Because I have seen this same things in India as well. Doctors have a struggle to convince these students, convince the people that people because come with a chat GPT, with a complexity knowledge, maybe that's a based on the other things. So then our doctors do tell them that how the things are and are they are based on the real life incidents. So the same way, I want to
So
know what does the AI assisted fetal surgery
yeah,
looks
so I
like
think
in 2030?
so I think as doctors, as I said, it's always better to have informed patients.
Mm.
There is no harm in giving different opinions. That's absolutely fine. And as a doctor, it's my task to be able to convince you with evidence. Those days when medicine was practiced by experience has gone. Today's
Okay.
medicine is evidence-based medicine. If there is evidence, then
Mm.
that is what we would. And I think that's very important for everyone who goes and consults a doctor, that they need to challenge any opinion and recognize what is evidence and what is not evidence based. So I think that's one thing absolutely sure. With regards to surgery, I think AI in surgery is a very new coming field, and
Mhm.
I think still have to wait and see. AI certainly helps in planning surgery. So suppose if I want to do a surgery on a baby that is inside the womb, then AI helps me plan my access as to where should I take the incision, how much blood flow that area is, whether I should use an alternate area, how do I manage the blood flow, whether I need to take some extra steps to reduce blood flow to that area. Otherwise, patients will bleed a lot. So I think AI helps me in doing that. But at the moment, AI is not in any way going to replace a doctor performing surgery in any way.
So in the end, that doctor are saved from the AI as of now.
Yes, as of now.
Okay. So doctor, you have worked in UK public health and now you are with the UAE private healthcare, right? So what kind of difference did you find in both the worlds or both the systems, healthcare systems? And what are
I
the
think
biggest operational difference?
I think the major difference is that the NHS is a publicly funded healthcare system. That means
Mhm.
all the hospitals are run by the government, and healthcare is free for all, irrespective of your
Mhm.
paying capacity. So you go to the same hospital, you are in the same line, everybody is seen on the same standards, and everybody gets the best care. But
True.
obviously, that is expensive. And that's the current challenge that the UK NHS is facing, because healthcare is becoming very expensive. Everybody wants the best, including the doctors. So the government is struggling to fund the NHS, and that is why we see all the hue and cry and the drama about the NHS failing. NHS still continues to be the best healthcare system in the world. After having worked in many parts of the world, I can even today say that there is nothing better than the NHS, and people in the UK are extremely lucky to have a
Okay.
system, the NHS, with its own drawbacks, but it's still the best. UAE is a completely financial healthcare system, like in India. You can either
Mhm.
pay, you can have insurance. Insurance is
True.
mandatory in the UAE. Everybody has insurance, but the insurance depends upon your paying capacity, whether you have a good insurance or a bad insurance, or a not that great
Yeah.
insurance. If lower level insurance, there are certain hospitals that you cannot access, and there are certain
Mhm.
hospitals that are meant for lower level insurances. So that is a challenge. Access to quality healthcare, I would say, can be a challenge. But otherwise, UAE has access to the best healthcare facilities based on the type of insurance you have.
So I guess so. If I talk about the operation, what are the difference between both of them as an operation point of view?
So one is money based, one is non-money based. So in the UK, you get the best care irrespective of, you don't have to pay anything.
Okay.
Whereas in the UAE, it all depends upon your insurance. And I'm
Mm-hmm.
sure the challenges of insurance, people in India are very well versed with. because
Yep.
the insurance companies are the same, whether whether it's a UAE or whether it's India.
Same here, same here. So we have come back to Indian, and as I'm living in India, so I have three questions related to India, right? So Indian parents are more often terrified of a bad pregnancy news. What do you wish they understood about modern fetal medicine, according to Indian parents?
So I think everybody wants a perfect child, and there is nothing wrong in that. Fetal medicine is a very new field and is very rapidly expanding. I think the challenge in India is getting access to the right type of doctors who know the latest evidence in fetal medicine. Unfortunately, in India, access to termination of pregnancy is very easy, which is a good thing. But that also means that we are probably losing a large number of normal babies because of almost, you can say, the fear created after having a scan that the baby may be abnormal, in spite of the baby being completely normal. So basically, today, instead of losing babies that probably are not formed well, we are losing
Mhm.
normal babies in the quest of having perfection in life. I think the call dropped off, Kuwar. Hey, Kuwar, call dropped.
Yeah, yeah, I'm here. I'm here.
Yeah, okay. Yeah.
Okay. So I guess I missed a bit of last 1 minute.
Yeah. So, uh, sorry. So, what I'm saying is today the challenge is trying to get the right type of care, the right
Yep.
opinion, so that
Mhm.
we can at least prevent the normal babies from being labeled as abnormal and ending up in termination.
Because a lot of people doesn't understand how the surgery is. They still have a mind that the medicine, fetal medicine, is just like an old one. I guess there's a need. The fetal medicine need to come forward and inform the normal people or maybe the generic audience that they should not fear about the fetal medicine. They can give more trust of them to the fetal medicine nowadays.
Yeah. I
Because
think one of the
yeah.
challenges in India is that there is no recognized qualification in fetal medicine. So people do 15 days training, 1 year training, 6 months training, 3 months training, and they all call themselves as consultant in maternal fetal medicine. Again, that's nothing to do with the patients. The patients can't do anything. That's for the government to take care of that, standardize the training. But from the patient's point of view, I would just say choose your doctor well, go through
Mm,
their qualifications, obviously go and meet them, and AI is your best friend. If they make a
yes.
diagnosis, check with AI and challenge your doctor.
I guess the doctors in the future are going to face a very hard time. People are going to ask a lot of questions to them.
No, I think it's about empowering the patients. I think that it's not
Hmm.
about challenging the doctors. It's about having patients who are well informed and empowered to make the right choices for themselves.
That's true. That's true. So one thing I want to know about the high risk pregnancy that is completely misunderstood by public. Why it is so?
So, I think everybody wants to have a normal, safe pregnancy, and that is absolutely right because pregnancy, we have to remember, is not a disease. It's a normal physiological process. Every woman would go through that. I think sometimes, as medics, we over medicalize a condition, and unfortunately, pregnancy in private healthcare systems has been over medicalized. Yes,
Hmm.
there are small number of women, maybe 15 to 20% of women who would have medical disorders or in whom the pregnancy may not have adapted well. And those are the ones that need to be looked after by doctors. And I think there is enough knowledge about that. So I think the most important thing is recognizing whether you are high risk or low risk based on your general health condition. So I think if you're low risk and
Hmm.
everything going well, then there is nothing to worry about. Obviously, if there is a risk factor, then we can diagnose and manage that very well today.
So, if I want to have a suggestion from your side, if some woman is high risk pregnancy, what kind of things she should be aware of, like about food, about the activities, what are the or maybe a timelines she should be aware of?
So, as I said, pregnancy is a physiological condition. Eating well, a
Mm.
good diet, looking after yourselves, yoga, meditation, walking, healthy lifestyle is all I can advise. Don't be overburdened by doctors prescribing protein and lots of multivitamins, because none of that works. In pregnancy, all you need is uh, iron and vitamin D, and some may say, well, calcium. Again, there is no good
Mm.
evidence about that. Other than this, there is nothing else that is required for a healthy person. Obviously, if you have certain deficiencies, then yes, we can supplement that. But for a normal pregnancy, simple iron and vitamin D is what you would, and good healthy lifestyle is what you would need. So that's my advice. Don't get overburdened by lots of prescriptions and all these advertisements, because that doesn't work. That only takes money out of your pocket and nothing else works.
It will take and it will give the tensions as well.
Obviously, when you're on a lot of medication, you will feel that you're
Mhm.
high risk, even if there is no risk factor.
That's true. And I guess you have already covered my next question, that how do you take today's corporate lifestyle or Gen Z's lifestyle towards the pregnancy and all? Because there are two
Yeah.
different things.
I think Gen Z is very well aware of lifestyle choices, and they are healthier. They are fitness freaks, which is very good. Obviously,
Hmm.
there are people who would be on supplements to build muscles and all that stuff, which I'm sure they are intelligent enough not to use them in pregnancy. But
True.
I'm pretty certain that the newer generation is very well versed of how to look after themselves, and they should continue to do that. And choosing the right guidance, again, choose help of AI in doing that.
Hmm. That's correct. That's correct. Because I've seen in Gen Zs actually know about their health. They take care about more than the millennials. And I've seen a lot of people in the corporate lifestyle. They are hampering their own lifestyle by the unhealthy food, partying, or maybe the over drinking part. And Gen Zs have clearly said no to the mental. They have already no to these kind of things, and they're more concerned about their mental health. And I guess millennials, they're like, okay, jo hoga dekha jayega, will go ahead. Whether they have a headache or something, they're okay to take it.
Yeah.
Okay. So, two things. First, if somebody wants to come from India to UAE as a doctor, or maybe UK, as you have worked in the both the places, what are the things they should aware of, and how they can make it better way for them? How it can be better way?
So I think once you've done your training, your MBBS in India, and if you want to go abroad, I think UK, US, Europe, Australia are very good training systems. But they are good training systems because they have been training good doctors, and they've had good doctors for many years. So I would suggest looking out for those countries. And then once you have put yourself very well, and you are at the stage where you want to like retire in the next 7 8 years, UAE is certainly good. You can come and then work, and then obviously earn money in the UAE. So essentially, the West is for training and getting the best knowledge, and UAE is for practicing and making money.
That's great. And I guess any exams they want to give, while as you told about UK, but is there anything in the UAE?
Yeah, as doctors, I think you should not fear of exams. Your entire life is will be full of exams. I still do exams, and I think exams should be your friend in medicine. So don't worry about exams. Exams will be there at every stage. If you're not
Mm-hmm.
giving at least 4 exams a year, then you're not doing something right.
The exam is, it will be a good new best friend.
Yes.
Okay. So while researching about you, sir, I have two things right now as your big surgery story, which I have given it. One is your walk through the day you performed your first in-utero spine bifida repair. But what was going in your mind, and when you were operating on a baby that hasn't been born yet? How was the feeling?
So for those, it's those who don't understand that part, it's defects in utero spina bifida repair. So spina bifida is a defect which is unfortunately very common. Happens in around 2 in 1,000 pregnancies where the baby's spine is not closed completely. So there is a gap in the back, and through that the spinal cord is exposed, and that because it is exposed, the spinal cord undergoes damage inside the womb, and these babies when they are born will not be able to walk or be able to pass urine or open their bowel. So it's a big disability, and this is for the rest of their life. There was a breakthrough study in the US which showed that if this defect was closed at around 24 weeks, when they were 24 weeks, maybe that is in normal language around 5.5 6 months of
Hmm.
pregnancy, then these babies have a better outcome, they have less disability. So that's where in utero fetal surgery came from. So obviously doing, it's a very complex procedure. There are a lot of risks both to the baby and to the mother, and it's a challenge because if you don't do it, yes, there will be disability, but the baby and the mother will be okay. If you do it, there's a risk to the mother and baby, but disability will be less. So it's a difficult choice. But yes, doing that day, because it was the first surgery in the UAE, it was extremely challenging. But then, as you say, you just pray to your God, leave everything to Him, and just do what is right, because we've all been taught to always do what is right for the patient. And I think once that procedure was again, doing the procedure is only a one part of the puzzle. There is a long journey for both the mother and baby, and for you as a doctor. So yes, it was a relief that the procedure went well on that day, but the journey was still incomplete. Once the baby delivered and the mother went home, then you can say, that's success. And that unfortunately takes almost a year from when you have done the surgery.
10 years,
1 year at least.
1 year.
And the entire journey for
Mhm.
the baby is up to the age of 18. So you have to follow the baby up to the age of 18.
That's a really long way to go.
Yes, yes. But
Mhm.
that's when the real difference is what you would see.
So another thing which I want to add, that you have spoken about that want to bring to the this to in India, and how far your vision is right now.
So I think India is a complex social system. Everybody wants a healthy, perfect baby, which is absolutely fine. I think in India and in any part of the world, choice is very important. There will be
Mm.
parents who would say, you know what, we don't want to take any chances because there is no 100% guarantee and we don't want to continue with pregnancy. That is absolutely fine and that's their choice. But there will be parents who will say, this is a gift of God and I will
Mm.
take care of this baby as long as, and I will always take care of this baby. And that's where our role comes in, that we can make life better for these babies.
Like you are doing the one of those things where India is still lacking, because thousands of children die every month
Yeah. So
in the
India has a
womb.
complex health challenge, and I think
Mm.
diagnosis is one of the important challenges in India. And I think, but things are getting better as the patients are getting more informed and accessing better care. I think there will be time when parents in India would also say, come and operate on my baby, and that's absolutely fine. At the moment, there are not there's no center in India performing the spina bifida repair. And when we talk to them, these centers, they always say that, our patients don't want to continue pregnancies that are affected by spina bifida, which is absolutely fine. But if there is anybody, then we are always around to help them.
Yeah, because I guess this is because people doesn't know about the this surgery or this actually exist. and there's no information given by government on the healthcare sectors to them that this can be performed and maybe your child can be back to normal if you want to. I guess there need to be more awareness for this surgery.
Absolutely.
One last thing, doctor, I want to know if an Indian founder wanted to build a health tech startup in the fetal care, what is the biggest unsolved problem he need to unwrap or maybe he need to work on?
I think I've always felt that there is a big gap between the tech sector and healthcare delivery.
Hmm.
I The problem is with us. We are not able to communicate to the technical partners as to what is important for us. They work in their own silo, we work in their own silo, and the product that comes out is good, is excellent, but is not something that will change care for the patient, because ultimately it is about the end user. It's not about what I think is right or what the tech person thinks is right. And that journey is long. In tech sector, there are many
Mm.
other things that will give you money instantly. Unfortunately, health tech, there is a big gestational age, and the product takes long time to mature. The second challenge is that healthcare is unpredictable. 2 plus 2 is never 4. It is never going to be 4. And I think tech, you can do better if 2 plus 2 is 4. It doesn't understand
Mm.
it becomes 5 or 6 or 7.
Can be correct. So I guess, the doctor, you have given a very good examples, I would say, in a very layman language for everyone to understand it. And I guess we have covered a lot of things from education, health tech to the education, how they need to be, how the career can be gone. And I get by this podcast, maybe a lot of some people see in the government as well, and maybe they can help us, or maybe help the healthcare sector to get into the fetal medicine awareness that can really help the new babies to come up normal, or they can live their life. Thank you, doctor. Thank you for the time, and I hope we will see the people questioning or commenting on our podcast. I will forward them. And if anybody wants to connect with him, I can drop his LinkedIn profile in the comment box or maybe in the descriptions. You can get in touch with the doctor and maybe doctor whenever you get time, because yeah, whenever you get time, he will revert you.
Absolutely. Pleasure talking to you, Kuvar. And I'm happy to link up with any medical students, any students that want to take up medicine or are doing post graduation and want to seek guidance to go abroad or choose place of work. Happy to guide them. Obviously, Kumar has all the details, and I'm sure he will share them with anybody who needs. So please contact him.
Definitely, I will. Thank you, doctor. Thank you for joining.
Thank you. Thank you very much.
I'm just stopping the recording.